Your child's nighttime bedwetting can disrupt sleep and throw your child's self-esteem for a loop. But for kids 5 and under, it's pretty typical behavior. Keep watching to find out more about this sleep disorder, why it happens, when you should consult a doctor, and how it's managed. A tap on the shoulder wakes you. You turn over to see your child standing by your bed. You know what has happened. You stumble to his room, gather blankets and sheets in a heap, then make your way to the washing machine. Your child has had another episode of bedwetting. The routine has become familiar, where nights are interrupted by the changing of sheets and pajamas. If this sounds like a typical night at your house, your child may have nocturnal pediatric enuresis, commonly known as nighttime bedwetting. What are the types of bedwetting? Bedwetting in children is actually very common. About 15% of children wet the bed when they are 5 years old, but not all bedwetting is similar. Some children have monosymptomatic enuresis, which is bedwetting with no other urinary issues. It's considered primary bedwetting when episodes are consistent, and secondary bedwetting when an episode occurs after 6 months of dry nights. However, in non-monosymptomatic enuresis, a child has some form of dysfunction, like voiding frequency issues, daytime incontinence, or a weak stream. Bowel and bladder dysfunction may also lead to nocturnal bedwetting. Maybe you're scratching your head and wondering why. We're about to cover that now, along with methods to manage bedwetting and when to see your pediatrician. Why do kids wet the bed? For 5-year-old kids, bedwetting reduces by 2 to 3% per year, which may be due to maturation of the central nervous system as a child ages. Although there are other possible causes for the occurrence of enuresis, including genetics, hormone imbalance, poor sleep, and abnormal urinary activity. Along with causes for enuresis, there are plenty of associated reasons bedwetting could occur. Any dysfunction in the bladder, urinary tract, or bowels could occur along with bedwetting. Some other disorders, such as autism, ADHD, and seizures, have been known to cause bedwetting as well. Genetics seem to be a strong indicator of whether a child will have episodes of nocturnal enuresis. Children of a parent who had episodes of bedwetting have a 50% chance of having episodes as well. The likelihood goes up to 75% if both parents have had episodes of bedwetting. Luckily, pediatric nocturnal enuresis often resolves on its own. When should a doctor be consulted? Although bedwetting can resolve on its own, it is still important for your child to be evaluated. If the bedwetting is causing disruption in sleep or life, an evaluation of bedwetting is done to determine if there are causes for the episodes that need to be addressed. Commonly, a physician will ask about urination or bedwetting episodes, developmental questions, and family and medical history. A urinalysis may also be conducted to rule out secondary causes like diabetes or UTI. How is bedwetting managed? If you and the physician decide that treatment is needed, there are options. The first step is an attempt to change behavior, encouraging the child to urinate prior to bed, and rewarding the child when they wake up to use the bathroom are common methods. Additionally, an alarm can be used to wake the child when bedwetting occurs, to try and train them to wake prior to wetting the bed. In some cases, the use of the medication desmopressin is prescribed, which helps the child hold their urine until morning. However, there is a higher incidence of relapse with this treatment, so it should be used with an alternate treatment, like an alarm. While bedwetting can be stressful for both the child and parent, the issue will commonly go away on its own. But if bedwetting is disrupting your child's sleep, reach out to their doctor to get help for drier nights and better sleep. Help is available.